Hi everyone, thank you so much for joining us tonight for our exciting webinar on natural menopause health, weathering the change. I'm just going to give everybody a few more moments just to start, if that's okay. Like we're just waiting on a few more people to join, and then we'll get into what we're talking about tonight. So again, thank you all for joining the webinar. And you know, education at Mullen Health is a big part of what we do, and we're really passionate about getting the message out there about natural health. So yeah, we really appreciate you guys jumping on tonight, having a listen to the webinar. And if you like what you're hearing, please tell your friends about what we're doing as well. Alrighty, so tonight, hi everyone again, and welcome to tonight's webinar, Natural Menopause Health, Weathering the Change. I'm Peter Mullen from Mullen Natural Health Centre in Newcastle, New South Wales. And tonight, I'm really excited to be speaking with our resident menopause expert, Jennie Driscoll. Now, tonight's webinar will go for approximately 40 minutes. So please, if you have any questions, send them through and Jennie and I will do our best to answer them as we go. Now, a bit about Jennie before I introduce you all. Jennie's a degree qualified naturopath, herbalist and nutritionist with nearly 20 years clinical experience. And we're so excited to have her working with us at Mullen Health. Jennie's great love is seeing the change people can make in their lives when they're supported and guided. And she specializes in or is really passionate about healthy aging. Aren't we all? Menopause and women's health, vitality and fatigue, weight loss, stress, anxiety, insomnia, as well as wellness programs. So good evening, Jennie. It's so lovely to be talking with you tonight.
Good evening, Pete. Likewise.
Now, I'm so excited tonight. Tonight's discussion is around menopause. And Jennie, 2 points from your menopause talks always stand out to me. And I think the first point is really, really important. And firstly, that menopause is a natural transition, not a medical condition.
Absolutely, Pete, and that's one of the key things that I would really like to go over tonight. It's a very important concept for everyone to feel comfortable with.
Now, secondly, that in treating or supporting one of our patients through the change that is menopause, it is not just about the hormones. So as naturopaths, we treat and support the whole system. So Jennie, a lot of people listening might think that, you know, the way they've been educated around menopause is that if you're struggling with menopausal change, you need to take hormone replacement. But we know that it's so much more than that. What other systems are involved when we talk about menopause?
Well, the key ones, I mean, obviously there's your reproductive system, which everyone would automatically think is absolutely involved. But also really important is the health of your adrenal system, which of course, and we'll be talking about this this evening, but that's how we manage our stress response. The other area is having a liver function that works really well, because that's actually important for metabolizing all of our hormones, along with, of course, our nervous system. Got to have a healthy thyroid. It really is, as you say, it's the whole body. It's not just, oh, what's happening with my hormones.
Yeah, I think that's such a good point. And I know we're going to dive a lot deeper into that tonight, Jennie, as we go. So just for starters, what is menopause?
What is menopause? Well, look, there's so many different answers that would come up when someone says, you know, well, what's menopause? You have the classical medical model, etc. And one of the things I think it's really important for women to remember and feel really comfortable with is it's a normal transitional stage in our lives. It's when we're moving from our childbearing years and we move into what's known as the wise woman or the sage. And, you know, I guess just stepping back from that a little bit in terms of, well, really what stages, what do you mean? Like, as women, we really have three key stages or phases in our life. First one is maidenhood, where we start to bloom. You know, we're young, the child, we're curious, passionate, really innocent and free-spirited. We're out there to learn and the likes. And we then, around the age of typically around the early 20s, move into the the stage known as motherhood. Now, this doesn't necessarily mean you are having to have children, but it's known as the motherhood phase, and this is where we've started to learn about things in life. We move into that role now of being nurturer and caretaker of our friends, of our family, of people that are in our lives. And a big part of this is the gaining of, I guess, our wisdom. And we also have started by this stage to really have learned what our needs are. And this is something as women, I think a lot of women struggle with, to acknowledge that we do have needs and that they're really important. And this is a key part for us all to remember, so we do work through in a healthy way our transition of menopause, which is entering that beautiful third stage known as the sage stage. And I read something once which I thought was absolutely beautiful, talking about what happens in the sage stage. It's difficult to say, Pete. It's a little bit like, it's when our colours are at their brightest and the most beautiful. I mean, isn't that a beautiful thing to think? You know, people are frightened of getting old, frightened of looking haggy and horrible. But the reality is, as we age and as we look after ourselves, women are very beautiful in that regard. Like, we've got all the beautiful wisdom in our life. During this stage, we live in our own style. We've become comfortable in our skin and much less not self-conscious. And this is a time for us, really, and this is what the menopause transition is all about. It's almost like something we really should celebrate, a little bit like when a young girl gets her first menstrual period. As a sage, we're focusing on our inner self and basically, what are we here for? What's our real purpose? So I guess that...
Sorry, I think that's just such a beautiful analogy for women through the transition of those stages over life. And I think our culture has lost a lot of that. We've
Definitely
lost that celebration of a young girl's first menstrual cycle. Like, again, our women's whole hormonal history has been sort of medicalized as being, you know, when do we start the pill? When do we start the HRT? When do we, you know, we've gone so much away from just really celebrating that natural process. And I think that's a great start for everybody listening to realize that menopause, and unfortunately, a lot of you might not agree with me, but being a male, but menopause is something that actually should be celebrated because it's the change, that transition to that next stage. So much better coming from you, Jennie, than it is probably coming from me.
And look, on that point, Pete, as you say, you know, with the transition of these stages, transitions, like with anything, can be difficult. It's all about change. It's about letting go from one reality, moving through what's very much the unknown to a brand new reality. And where we find ourselves in that transition stage with menopause, we're also by this stage about 45, 50 years old. So we've been around for a little while in our life, in our body, either living well, not so well. We've been exposed to, you know, things like pollution, stress, you know, possibly poor food choices, certainly not the caliber of food we used to have when Granny was around, that's for sure. And so this accumulation of some 50 years worth of living, I guess it's a little bit like, you know, moving house when you're a hoarder. That's not an easy job. There's a lot to clean up. And, you know, maybe throwing a few things out, but getting things back in order. And so really, to me, that's what having a healthy menopause is all about. It's getting things back in order. And that's what the main focus, as you know, will be, that we're talking about tonight. And also to help with that, you know, the fantastic safe and effective treatments that we have to help that process. So I guess a bit of a long answer, but to get back to your original question, what really is menopause? All of those beautiful things I've said, but classically, actual menopause is defined as your last menstrual period. And it's considered formally to have occurred when you haven't had a menstrual cycle or a period for 12 months. And at that stage, terminology-wise, a woman is considered to be postmenopausal. And the reason I wanted just to mention some of these words, and we'll come through to more terminology, is these are the sort of things you'll hear when you're either reading, listening to radio interviews, and certainly perhaps when you're looking at your test, your medical test. And it's really good, I think, for you to have a level of comfort about what these different terminologies are.
Beautiful. Now tell me, you've talked about the stages of menopause. What so menopause is, as we're saying so far, it's a natural transition.
Yep.
It's something that, most likely or definitely should be celebrated, because it is a transitional change. It's not that women all of a sudden become out of date, or it's a new change. It's a new everything. So can you take us through the changes of, like, the stages, what happens with the perimenopause, menopause, and then postmenopause?
Yeah, look, absolutely. And I think this is really important too, because, I see, as you know, many women in clinic come into the clinic for assistance with symptoms or just understanding where they're at. And there is generally not necessarily a great understanding, well, what's actually happening to me, and when's things going to start, when are things going to stop? And I think it's good just to have that overall context. And typically the average age for women to start entering into that menopausal time is somewhere between about 45, 55. Having said that, so it's likely, symptoms are likely to start during this time, depending on how you're coming into the menopause period, will determine the level of symptoms you're having and the good or difficult transition period you're having.
Jen, just on that point, someone explained it to me once. I thought this was a really good analogy of what that change actually is. Menopause is about changing from a woman's fertile years, where the ovaries still have eggs and they're still ovulating every month, to the transition to being their post-fertile stage, where they're no longer needed to have children anymore. So basically, as the ovaries go through that transition, as we run out of eggs, so to speak, the transition from premenopausal to postmenopausal, as the ovaries decrease their production of estrogen, rather, what should happen is other glands or tissues in the body should kick in and help support that change.
Yep.
Because a lot of women think that, I'm sure, that when they go through menopause, that their estrogen just stops.
Yeah.
But other tissues or glands should kick in and help with that transition.
Absolutely. And that's where your adrenals come in. And I think if there was one key tip about menopause, and if you're approaching the menopause years, is the more healthy you can have your adrenals before you, or as you go into the menopause period, the less symptoms you will have, the more quickly the transition will occur. And there's so much we can do from a naturopathic perspective in helping women with that. But let's just say you're already going through those stages. Yet again, that's certainly one of the key areas that I look at as part of the overall picture in really supporting women to have as symptom-free as possible.
Yeah, healthy transition. Someone said to me once, and I thought this was a really good point as well, that a third of women maybe breeze through change of life, where their hormone levels and their or their pre-menopause levels and to their post-menopause levels transitions nice and gentle.
Yeah.
And that a third of women may go through this change of life without any real obvious symptoms.
Yeah.
A third of women may have a mild to moderately difficult time, and then a third of women can really have a lot of issues. So I think that's really important to make that point as well, is that not everyone struggles with the change. Like, it's in other cultures, in other countries, menopause is not something that they actually even talk about as a medical condition. So something's definitely going on in our Western culture that we're having more challenges with that change. And I think a really great point for everybody listening to sort of get the gist of is that if you've had a lot of stress, if your adrenals have been really taxed, and unfortunately in this day and life, our stress coping system is really stretched thin for a long time, even before we get to the menopause, then your transition may be a lot more rocky if your nervous system is stretched too thin.
But that also, and that's so true, Pete, and I think those figures you were talking about there, it's really comforting, I think, for everyone listening to know that, it's not predetermined that it's going to be awful at all.
Yeah,
it doesn't have to be. what comes into play is everything that you've done, experienced, etc., leading into that period, and then we can help support you and nurture you through that. And I guess, at that time when we do start to go into the menopause period, that's when we start to potentially have some symptoms, and the common symptoms, of course, are things like, irregular periods, heavy bleeding, hot flushes. That's a big, big thing that I see a lot of, and night sweats, and some really terrifically effective herbal treatments that we can use for that. So it's not something you necessarily have to endure. And that period is known as perimenopause. So peri is the word around. So it's obviously the time around actually having menopause. And, there could be times when menopause happens for you way earlier than what the averages are. Like I was saying, typically between 45 and 55. And sometimes things will happen that your ovaries actually stop releasing the eggs, and the likes that Peter was talking about when you're less than 40. And at that stage, that's known as premature menopause. And that can come about either for hereditary reasons, common medical treatments, drugs, chemotherapy, etc., and, certain surgery and the like. So, some of these stages, as I was saying, are terms that you'll hear, and I think it's just good to have a bit of a sense of what do they really mean. And probably in summary, it means approaching, arrival, and after, like the 3 A's, So, yeah.
That does sum up that transition very well. Now, Jen, before we get into the symptoms of menopause, what's actually happening in a woman's body to cause these symptoms that we're starting to talk about?
Okay, well, I'm sure everyone's hugely familiar with the fact that there's lots of hormones there that get in the way, that do things right, do things wrong, whatever it might be, but their hormones are out of control and therefore so are they potentially, or they're a bit fearful of all this. And yes, certainly there are a number of hormones involved in the menstrual cycle. And ideally they work together in this amazing system to create that regular pattern of our menses, say every 4 weeks or so, through our menstruating life. I guess you could liken it a little bit to a team sport, like of netball. Netballers, a nice netball team. And like has an Australian women's netball, like we're the number one practically in the world, aren't we? Amazing. So I guess if you think of what do the netballers do? They throw the ball around, they're calling out to each other, they move around really quickly, saying pass it here, don't pass it here. I need it now. No, stop, don't give it to me. That's what our hormones do. And, this is all under this amazing control within our body where we have this master gland and it hears all of this. It's sort of like juggling 1,000 different balls at once, and these incredible feedback systems. And these feedback systems are just really a way of sending messages, which are your hormones, from this master controller, who I guess is the ultimate coach, known as the hypothalamus, down to the worker bees. And the worker bees, of course, are our ovaries and our uterus, telling them to do something or stop doing something, So everyone I see typically has been to the doctor and had blood tests and also has done a lot of reading. Most people want to know exactly, to understand to the best of their ability what's actually going on. And so I thought just really simply, without getting into the complexities, just to explain the 4 key hormones that we're looking at. So the main players, I guess, are, and you'll see these on your blood tests, are FSH. And everything's abbreviated to their initials. So FSH stands for follicle stimulating hormone. And think of this as, we hear follicle stimulating. Follicule's actually our little egg. And so it's fattening up the egg in the ovary each month. So you get a nice, plump, juicy, gorgeous egg. That's what FSH does. Under control from head coach. You've then got another key one called LH, or luteinizing hormone. And what luteinizing hormone, I guess that's sort of like the goal shooter. It's like it's causing the egg to burst out of the ovary each month at ovulation. And of course that happens first on the left, then on the right, first on the left, then on the right, ideally. That's what's meant to happen. You've then got the others, which I'm sure you've heard of: estrogen, progesterone, testosterone. And yes, we have testosterone as well, just not as much as Pete. Hence, Pete goes bald, and hopefully I don't.
Thank you for pointing that out. So.
No worries, Pete. And, you know, they are produced in the ovaries and some in the adrenals, as we were talking about before, and they just control so much of the activities of the cycle and different things and activities that happen in the body. And I guess then what actually is happening, just to, you know, to complete the story, Pete, is, I'm not sure if everyone is aware, but we're actually born with all of our eggs. So we don't actually make any more, you know, we come fully loaded, ready to go. And they live in this really lovely little fluid-filled sac, which is called a follicle. And that's kept inside our ovaries. And I actually had someone say to me the other day, because they'd been through a partial hysterectomy and they'd left one ovary there, that she thinks of it and she meditates on it as being her beautiful, sacred safe. Isn't that lovely? And that's what our ovaries are. So each month, our netballers, the hormones, they let one egg or one little follicle out to get fattened up. And so then once it's fattened up, it gets released, it goes down the fallopian tube into our uterus. And so here the netballers fatten up the uterus as well, and they create this beautiful, lush landing pad inside our uterus for the egg to go. And if the egg's fertilized and it embeds in this beautiful little bed in our uterus, we become pregnant. If not, we shed that lovely built-up lining in the uterus, and that's when we have our menstrual bleed, and then the cycle starts again. So that's what's happening normally. So now, given, as Pete was saying before, that our eggs are in the ovaries and also produce the hormones, estrogen and progesterone, as we get older and we don't have as many eggs as we would like, and our eggs perhaps also age, so they're not necessarily fully functioning. And plus our team players, the hormones, they become a bit deaf, a bit exhausted, and they start screaming when they shouldn't and not listening when they should. So basically all of our messaging doesn't really help us work as smoothly as it should. As our eggs further deplete, our levels of estrogen, remembering that our little eggs release estrogen, our levels of estrogen and progesterone start to fall because the eggs can't really produce enough anymore. So the master controller tries to compensate by turning up the volume to its messages. And so as fewer follicles remain to be stimulated, so there's not enough there for them to hear the messages from follicle. You remember FSH, the follicle stimulating hormone? There's not many there to actually hear the message. And so our estrogen levels decline even further. And what then happens is, because the master controller is pumping out more and more and more of this FSH, trying to get the message through to plump up, our FSH levels rise. It also causes a rise in the luteinizing hormone, which is the one that says, okay, egg, get out, off you go, down the fallopian tubes, please, please, please go, please, please, please go. And so luteinizing hormone also rises because your body's really desperate to try and get these eggs to burst out and ovulate. And what happens around that time, and this is leading into one of the key symptoms that women will feel and experience, is, you know, the hot flushes and the sweating. Your FSH can actually increase something like about 10 to 20 times its normal levels. And luteinizing hormone also increases, but not as much. And that can often have like a 3-fold increase. And it's these increases in those two hormones, as well as the drop in the estrogen, that will get picked up on your tests when you go to the GP. So if you've got a bit of a sense of that, of if your FSH is high, and normally once it's over about, there's a range, but typically over about 38 is on your testing, that's considered that this sort of whole netball game isn't working as well as it should, and that's where you're at. So estrogen's dropping, FSH and LH are rising.
So when we talk about the symptoms then, like let's go through some of the common symptoms. But are the symptoms caused by the raised levels of this FSH and LH?
Partly, but also to do with the drop in the estrogen.
In estrogen as
and
well.
also the drop in progesterone.
Yeah, which is often not talked about as much as the estrogen, is it, the progesterone? So
No.
let's get into the symptoms, because I'm sure everybody listening will be aware of the symptoms. But then let's get into the symptoms. Then I particularly want to talk about hot flushes, night sweats, and mood swings. So common symptoms associated with this transition. Again, reiterating that the more symptoms you're having with your menopause as you go through the change, the more indicative that is that there's other systems out of balance. Because remember, going through the change should be not easy breezy, but it should be a lot more calmer than what we see with a lot of the patients that we see. So in essence, we can say, Jenny, can we say that if you're having a lot of symptoms with the menopausal change, that it's more indicating where your whole health's up to, rather than just being about your hormones?
Yeah, look, absolutely. And excuse me, I'm sorry. One of the big areas, one of the biggest areas, I think, that influences the amount of symptoms we get and the intensity is stress management. How stressed are you?
Yeah.
How well do you cope? And hence, we'll talk a little bit later on supporting your nervous system, supporting your adrenals. But
supporting those adrenals.
And your liver as well. Like our liver gets such a battering, doesn't it? It's one of our key filters in life. And, it copes with a lot. It copes with the wildness that we went through when we were 18, 19, 20, perhaps. Maybe the wildness we're still going through. But if it's not clean and detoxing and able to do its job properly, that also makes things worse, Pete.
Makes the menopause more rocky. So what are the common symptoms, Jenny?
Look, there are many symptoms, but I think probably the most common ones are beginning of an erratic or irregular period. And often it becomes
Is that perimenopause, where we're going to see that, where the period starts to change?
Yes, all of these sorts of symptoms are an indication, and usually irregular periods is one of the first. You might not have any other symptom, but suddenly, you missed a period. You might freak out, goodness me, am I pregnant? You missed a period, or it's longer or it's shorter. That's often one of the key signs you're entering into that perimenopausal period. Another big one is heavy bleeding. And, heavy bleeding comes about, again, for a variety of reasons, health of your liver, etc., but also progesterone. And the ratio between progesterone and estrogen is a big one there for determining what your bleed will be like. And the unfortunate thing, it's a bit of a vicious cycle, and this happens regularly, is the more you bleed and the heavier your period is, the more iron you're losing. And the more iron you lose, the more heavy you bleed, because you lose your clotting factors as well. And it's something else I see a lot of is a lot of the tiredness can be actually iron deficiency, anemia.
Iron deficiency. And iron deficiency is the most common deficiency in the world. Interestingly, followed closely by zinc. No one ever tests for, just saying.
Yeah, and zinc's something else that we all, always test to see what's happening with zinc, because zinc, along with magnesium, of course, is involved in some over 300 odd enzyme reactions in our body. It just makes everything work. So
some of these menopausal symptoms may be exacerbated or contributed to by nutritional deficiencies as well. So definitely. When someone when a lady's coming up to the change, like how healthy you are coming into the change, how balanced your system is coming into the change, is going to play a big role on how you go through the change as well. Is that fair comment?
Yeah, for sure. And in working with women who are gearing up for a healthy menopause, a little bit like preconception care when you're trying to be super healthy before you get pregnant, trying to be, premenopausal care, be healthy for when you actually go through all that. So diet, lifestyle, and making sure you're maximized in all the areas you need to be makes a big difference. And I guess,
back to
the common symptoms. Big one, hot flushes. hot flushes, and you may or may not have sweating happening at the same time. The sweating usually occurs at night, so you get the night sweats, where 1 minute, you're throwing everything off, and your husband or, your partner is like, what are you doing? And, they're just feeling a normal temperature, but, women can end up absolutely soaked 2 or 3 times a night. It's really debilitating, and it's really difficult and uncomfortable. And as well as that, of course, it really messes up with your ability to sleep. And
So insomnia is a big factor.
insomnia is a really big one, which then leads into many of the issues women face in having really big mood swings, which is another really common thing. 1 minute you're angry, next minute you're crying. You can get depressed. You get a lot of anxiety. You don't have to get a lot of anxiety, but think about it. Any time, you've been depleted from a good sleep over a period of days or weeks, your nerves are jangled. Your nervous system and your adrenals are being attacked by 20,000 saber-toothed tigers, and there's no break. And of course you'll be angry. Of course you'll be more likely to be a bit snappy, or you just had it. You don't normally feel like this, and it can be quite frightening. And another common theme that does come through is, I guess, which is related to feeling a bit depressed and anxious, is often feeling unloved. I have women say they just don't, they think something's really wrong with them, and they just feel really unloved, and, which is an awful place to be, because everyone is absolutely lovable and worthwhile. So, they're quite challenging to experience, but they're absolutely things that, I have good success with, with herbal medicine, with basically our naturopathic focus. There are a number of others. Do you want me to touch on the others, Pete, or?
Yeah, just briefly.
So another common one is loss of interest in sex, which can, potentially cause issues in the relationship, or just feeling, I guess, upset or ripped off oneself, from not actually feeling like sex. Now, this can be to do with sex drive. It can also be to do with, often intercourse can become quite painful. And the reason it becomes quite painful is the mucous membrane lining the vaginal cavity starts to thin. Because one of the things that occurs when your estrogen levels drop is that your mucous membrane lining there, the tissue, loses its integrity, and so it can actually be quite painful. So of course you're going to be less likely to feel comfortable in having sex, because that's something, as a woman, we need to feel safe and just loved in that moment, not worrying about, gee, is this going to hurt me? The same type of thing will lead, so that with the vaginal dryness, but often dry skin. Often women will notice, just their body skin, their face, and likewise with the thinning of what happens with the tissue. There can be a little bit of urinary frequency,
Yeah,
and
we see
bladder
that. We see that
irritability.
a lot, where women, as they go through menopause or
Yeah,
after menopause, that they're more prone towards UTIs because of that thinning of the mucous membrane. So
yeah,
yeah, so it can be out of balance. Menopause, obviously, from what you're saying there, is very debilitating. But
yeah,
as you said, it's not something that women should just accept as part of their lot in life, or that it's normal for them, because there's a lot that can be done. So just back to so hot flushes, that's definitely so detrimental in so many different
yeah.
ways. What are some of the causes of hot flushes and night sweats?
Stress is a big one. As you know, stress makes everything worse. But when we're looking at it from a hormonal perspective, the hot flushes and the night sweats are understood to be caused by this really big raise of that hormone known as follicle stimulating hormone, the FSH, at the same time as your low estrogen levels. Because you've got that low estrogen levels, the follicle stimulating is trying to say, can't you hear me? Can't you hear me? It's getting louder and louder and louder. And overall, this causes those symptoms of your hot flushes, your night sweats, and potentially your mood swings. Although the mood swings tend to be more associated with the falling estrogen, progesterone. And it's also often associated, interestingly, with blood sugar imbalances. And so hence diet and nutrition is something that can, really work well in that area.
And just on that topic of blood sugar imbalances, as what we try and do with our patients is teaching people to keep their blood sugar levels more even, because we find blood sugar imbalances affect, away from menopause, even affect our energy levels. A lot of my anxiety patients have poor blood sugar regulation as well. There's obviously weight issues with that as well. So yeah, we always say sugar, refined foods, refined sugar is public enemy number one. But eating to balance blood sugars is a big theme of what we do. So Jen, we've talked about menopause. We've said that, menopause is a natural transition. It should be celebrated.
Yeah.
Unfortunately, with that list of symptoms there, at this stage, I'm not feeling there's a lot to be celebrated if you're struggling with all of that going on. So what can we actually do? How can naturopathy help with a lady going through menopause?
Well, firstly, I can say it can help enormously. And, one of the biggest symptoms of the most common symptoms is, hot flushes and night sweats. And maybe just if I can illustrate just with a little example here, with this wonderful patient that I've been seeing for a little while over the last few months. And I caught up with her a few weeks ago, and, we always talk about where are you at, what's improving, what's not, what's et cetera, et cetera. And so I think it must have been just when coronavirus had hit, Pete, and we were doing our consults by phone, and we weren't actually in the clinic. And so we were having a phone consult. So all I had was the voice. I couldn't see her body language and face. And I said, so how's it going with, and she had come in with really, 2 or 3 times a night, she'd have to get up, she'd have to take off her, pretty much her night clothes. She was soaking wet, then she'd get cold, and this was happening 2 or 3 times a night. She was so tired, it wasn't funny, understandably, and it was just really uncomfortable, and she'd had this for a while. So that was a key thing, and so just so you have an idea of where she was starting with it. So I'd seen her 2 or 3 times, it was gradually getting better, and this one time we were on the phone, and I said, and so how's your night sweats going? How's your hot flushes and your night sweats? And all I heard on the phone was this dead calm, dead straight voice saying, what night sweats, Jenny? And I thought, have I got myself confused here? Of course, she was being funny, but I couldn't see her face. They'd completely gone by this stage. And this took us, a few weeks to get there and a couple of great herb mixes. And she was completely compliant. But you really can have some amazing outcomes with what we do.
Well, look, I think we're going to run short on time. We have got tonight's talk as part 1. We'll definitely be doing a part 2, delving a lot deeper into some of the symptoms associated with menopause. But Jen, just to sort of sum things up, so what are the main systems you look at? And say, for instance, with how would you go about approaching someone that's going through menopause and they're struggling getting the night sweats, the mood swings? Like, what are the systems you look at firstly, and then how would you go about treating them?
The key systems that I look at, obviously do a really comprehensive case history, and it's very helpful to have a set of the latest blood tests, pathology tests that you might have had from your doctor as well. But quite specifically, I look at adrenals, so how well you're coping with stress, because of course that's what's left over to produce that little bit of estrogen and progesterone as well. And of course,
that's a really good point, that as the ovaries decrease their production of these hormones, other tissues and glands should kick in.
Yeah.
So because the current theory on, as we said, a third of women breeze through change of life without having major difficulties. And when you look at the current medical model, which is all about just supplying basically estrogen and progesterone, without looking at the whole picture, then you can sort of see that, like, so what a lot of people don't realize is that as the ovaries decrease the production of those hormones, other tissues and glands kick in, particularly your adrenals, and your adrenals will actually produce a less fertile form, but your adrenals can produce estrogen and progesterone. So this is why we say, that menopause is so much to do with your adrenals and how robust or healthy or resilient those adrenals are to kick in and support that change. So yeah,
Yep.
so adrenals are so important.
Adrenals are a really big thing, and sort of linking into that is also the health of your nervous system, and they work together. Your adrenals, your nervous system work together, so you have to support both. The other big one is your liver function. How well are you detoxifying? And there's all sorts of hints to what's happening there. What's happening with your cholesterol. Have you ever done a detox before? How much caffeine you're having, how much alcohol you're having, what sort of foods you're having, and you get a real sense of what's actually occurring with the liver. That's really important to be able to process the hormones.
And Jenny, we're also seeing a lot more patients these days coming in with elevated liver enzymes. So they've already potentially been diagnosed with having a fatty liver. So that's going to really affect this transition as well.
Definitely. And we can do a lot with that. The other thing is to ensure that, have a good understanding of how well the thyroid is actually operating, because your thyroid is very much a master gland, works very closely in with the adrenal system and, that master controller we spoke about before. And so we need to see what the health of that is like. And they're probably the big main ones, Pete. And of course, surrounding all of that is our overall diet, lifestyle, and getting our nutrition right is a very, very important thing.
So Jen, just on that score, and again, we're going to run out of time, but can you tell us just what your say top nutrients are that you treat?
Sure.
You put all your menopausal ladies onto,
Yep.
and maybe your top 1 or 2 herbs that we'd use. We were going to talk tonight about HRT and the pros and cons of HRT and how that fits in with going through menopause. But I think we might have to roll that over to menopause part 2, because we've got so much more information. We've got pages of your notes that you sent through to me that say so much information. But can you go through, just for anyone listening there today, what is it that they could start to do straight away from a nutritional point of view, a herbal point of view, obviously with guidance, and also, maybe your number 1 tip as well. So let's go nutritional, herbal, and then your number 1 tip.
Okay, so nutritional from a diet perspective is good quality protein, 3 times a day. The palm, chop off your fingers, your thumb, your wrist. There's your piece of steak, your chicken, your scrambled eggs, etc. Protein's really important for helping glucose, the balance.
Blood sugar balance,
Blood sugar balance, decreasing and being careful about the amount of carbohydrates you have, and having lots and lots of fresh fruit and veggies, especially your veggies, your green veggies and the like. Particularly things like broccoli sprouts, cauliflower, etc., because they really assist the liver in a lot of detoxification. Beetroot's great for that as well. But there's a whole plan that I usually give people to, adopt. I do find that there's a few nutritional supplements that needs an extra boost. The big one is magnesium, a really good quality magnesium, typically a powder, because to get the dose you need, if you're doing it in tablets, you tend to have big tablets many times a day, whereas the powder can be a really good formula. It can have other things in it as well. That's a big one because of the enormity of what magnesium does in your body. It also helps with your nervous system, your stress response. It helps create nutritive sleep, helps you be calm. We need to be calm. Another one is activated Bs. And so activated Bs just means, I'm sure you all know about B complex, but as we get older, and also just some people inherently don't have the ability to take the normal B of B2, B3, etc., B5, and convert it into what's known as the active form that your body can use. And so it's important as we get older to actually take the activated form. That makes a big difference with energy production. Of course, energy then flows on to everything that we're doing in our body. Another big one is vitamin C. And people often think vitamin C is purely just associated with the immune system, which of course it is, but the adrenals actually soak up vitamin C. So where there's you're wanting to support the adrenal system, vitamin C is really helpful for that. And I guess the other big one there, to help with things like the dry skin, vaginal dryness and the likes, is really good quality EFAs and often a dedicated vitamin E.
Yeah, for sure. And herbally, Jen, your top.
Did you want me to limit to 3, Pete? Is that what you said? Okay, for time,
I do,
will.
because everybody's going to be wanting to go to bed shortly, I'm sure.
Oh, okay. Probably, Pete, I'd have to say Ziziphus is fantastic with sage. We count that as one. They're really, really good for hot flushes and night sweats. Black cohosh and wild yam, we could sort of put them together as one. They're great. No? They're great for regulating estrogen.
You're a bit of a master when it comes to the herbs, and I've heard you say this numerous times before, the benefit of having a herbal medicine, like that your herbs are your secret weapon in helping women with the transition.
Yeah.
And the benefit of having a bespoke herbal medicine prescribed just for you is that it's totally individualized. And in that one herb mix, you can be supporting their adrenals, supporting their liver, helping with maybe some phytoestrogens, some progesterone boosting herbs, testosterone boosting herbs, so that you can really tailor that mix specifically to that person. I think that's what really, sets naturopaths apart from that, one size fits all. So
especially when you think everyone's experience in menopause is different.
So different. Yeah, it's interesting, isn't it? Like, and that's such a big point. But I think herbally, I know you could talk all night, so I'm going to have to finish you up there, my friend.
You're going to have to put a sock in my mouth about my herbs.
Well, no, actually, what we will do, as I was saying before, is we'll do menopause part 2 with a lot more practical tips that people can be actually doing straight away at home. But what Jenny said, for me, magnesium is the bomb for hot flushes as well. But herbs really are that secret weapon. The activated B, some zinc, vitamin C, etc. But keep in mind, as Jenny was saying, quality is everything when it comes to natural medicines. And like anything you buy, you really need to get the top quality practitioner prescribed supplements. Now, Jenny, we are going to have to finish up there now. It's been so lovely talking with you tonight. You're a wealth of knowledge, and I really love the way you present. I think it really talks to the whole process of womanhood and celebrating the transition as well. And I think our culture's still way too patriarchal, and we don't give enough credit to the power of that whole cycle.
Yep.
Where to from here? Now, for those of you watching, as I said, Jenny's our resident expert in menopause. So if you are struggling and you feel this is your time to get some help, this is a time when you really do with some added support and guidance. Jenny's available for consultation, either in our office, face-to-face, which Jenny loves, or we are also doing phone or video consults as well if you're not actually in Newcastle. Now, when the webinar finishes, so please, so if you feel tonight's the time or you'd like to make an appointment, you can contact our office tomorrow, make an appointment with Jenny. Tonight in a moment when we finish, a little survey will pop up on your screen. If you could take the time to fill out this survey for us, we'd really appreciate your feedback about future topics, about whether you found tonight's webinar to be really informative, whether you've got some great tips to take away and get started with straight away. Tomorrow we will be sending everybody that's attending tonight an email, and on that email we'll have some links to some blogs that we've written about menopause on our brand new website, so check out our brand new website. We're so excited about that. And also on the email we send you out tomorrow, with the webinars we've been doing, everybody's been so lovely after the webinars and the Instagram lives, sending us through messages saying how much they've really enjoyed what we're doing. And I do have a favour to ask. If you really do want to say something, if you want to comment, if you want to leave us a review, there'll be a link on the email that we send you out tomorrow. So please jump on board, leave us a review. As I said, we really value your feedback. Now, Jenny, thank you again for your amazing information tonight. Thank you everybody for watching tonight, and we look forward to catching up with you all soon.
Thank you,
Thank you,
everybody.
everyone.
Thank you, Pete. Bye.
Thanks, Jenny.